Hello, I'm Teresa Kelly, Executive Director for the Health Council of West Central Florida. With me today is Sarah DeLeon, Patient Navigator, who's going to talk to us about the various types of prescription medication access programs that are available. A recent Gallup poll found that 1 in 5 American adults could not afford their needed prescription medications. There's several reasons why people may have trouble paying for medications, such as high copays or deductibles if you have insurance, or the complete lack of insurance, making it hard for you to get to medications, as well as the increasing costs of living for things like food and housing and trying to balance your budget and determine where you can spend your money. And another reason also might be being in the donut hole for Medicare. So, Sarah, what options are available to people who need medication but can't afford them?
There are different options depending on your circumstances. There are discount cards, $4 medication programs, county or state funded healthcare programs, and patient assistance programs, sometimes called PAP.
So I've seen the ads for discount cards. Can anyone use them?
Discount cards are available for people who are insured or uninsured. These programs provide a card or an app on your smartphone, and when you take your prescription to a participating pharmacy and show them your card, they will tell you the discounted price. In some cases, this can be cheaper than your insurance copay. Enrollment is usually very simple. You fill out a form online or download the app and fill in some basic information. And you will either receive an actual card or the app will store the information on your phone. If you are insured, buying your medications this way may mean that the money you spend may not count towards your deductible or maximum out-of-pocket cost for the year. So if you anticipate meeting your deductible, you may meet it faster if you don't use a discount. But you need to check with your insurance company first to make sure you have all of the information you need. The pharmacy can also compare your insurance copay amount to the discount at the time of purchase so you can get the best deal. There are several programs available, so I suggest you do an internet search for drug discount cards to determine which one best meets your needs.
Thank you. So you mentioned $4 medication programs. How does that work?
There are a number of stores that offer these programs. These are generic drugs, and while not every medication is $4 for a 30-day supply or $10 for a 90-day supply, there are a large number of medications offered at a significant savings. Some of the places that offer this are Walmart, Target, Winn-Dixie, Sam's Club, or Costco. Some programs require a simple sign-up, while others do not. Just present your prescription for a covered drug and you will get that price. You can find the list of drugs included in the program and the cost for 30-day or 90-day supplies.
Yeah, I imagine all that information is online. So just to go on and look that up and see if it's there.
Yes.
So what about county funded programs?
Some counties have healthcare programs for low-income residents. They may be called indigent care programs or health plans. In our area, Polk County, Hillsborough County, and Manatee County have programs. Eligibility requirements vary by county, but if you qualify, you can receive medical care as well as prescriptions. Most programs require you to be a resident of the county and have income within the range specified by the program. The enrollment process will generally require you to provide proof of your residence and household income and fill out an application. Some programs have a minimal copayment for medications or other services, but these can be a great help for people who qualify them. Most of the programs in our area are underutilized. There are more people eligible than those that are enrolled, and each county has enrollment specialists to help you through the process.
Well, that sounds like another great resource, and other medical care can get covered under those programs as well. So the state has also started a new program that's called RX Connects, and that's all one word. So if anybody wants to go and look that up online, but what this program does is it collects unused medications from healthcare facilities and redistributes them in the community. And while it's not available everywhere yet, the eligibility requirements are that you be a resident of Florida, have an income up to 200% of the federal poverty level, and a valid prescription. Once you have meet that criteria, there is a form available online, and it's a pretty short form that you need to fill out and submit. There are new sites being added all the time, so please check back at that website and see if there is any repository in your area. It is under the Florida Department of Health, and again, it's RxConnects. That's what you want to look for. So that brings us to patient assistance programs, or PAPs. What are they and how do they work?
Okay, well, a prescription application program, or PAP, or a prescription assistance program, excuse me, or PAP, is typically a program offered through the manufacturer of the medication. You can always find out if the program is available for a medication if you know the manufacturer of the medication. But however, typically the eligibility for the program is based on a few things. You need to meet income requirements, which are generally higher income limits than county funded programs, have a social security number, and not have prescription insurance. When you fill out the application, that your doctor has to sign the application. The doctor also needs to write you, or your provider also needs to write you the prescription, and then you submit the application and the backup documentation to the pharmaceutical company. They review the application and determine if you are eligible, and in most cases, your eligibility is good for 1 year. Your medications will be typically sent to your home every 90 days. There are some medications, as well as insulins, that must be shipped directly to your provider's office. Also, to note that the prescription written for the medication will typically need to be a 90-day supply, in some instances, a 120-day supply, with either 3 refills for the year or 2 refills for the year.
So that sounds a little bit more complicated. So how do I find out if the medication I need is available?
The best way to find out if the medication you need is available is by utilizing a website called RxAssist.org. It's the one place that you can go. This can be especially helpful if you need more than one medication from different companies.
So I've pulled up rxassist.org, and let's see what we have. Oh, okay. So see here that they also have a savings card available too. So that's another one of those discount cards that's available. So if I come into Rx Assist and this is what I see, I guess I would go here for patients.
For patients, and you would learn more.
Okay.
Here you have a search engine, and you can type in a medication. If you would like to type in something as simple such as Lantus, Lantus.
Oh, okay.
Here they have listed the 2 types. One is a pen and one is a vial. Depending on the person and their preference, they can search either one. If you click on the medication, it gives you the program information, as well as the requirements, necessary documentation, and the application, and the program website as well.
Okay, so I see here, so here's my website if I want to go to the actual website at this point. And this tells me it's 400% of federal poverty level. And then, there's a handy calculator here. Let's see what happens when I go there. Okay, it's taking us to a different spot. Oh, okay. So it looks like you select the year. You would type in the number of people in your household, I guess.
Yeah.
And then your income, and then you have your weekly, biweekly, monthly, or annually. And then you can calculate it and it will tell you the percentage. There's also a chart here that kind of gives you an idea. So if your family size is 3 people and you make $3,000 a month, you would be less than 156% because that's $3,232 a month. So lots of ways to figure out what that is. I understand that federal poverty levels change every year, so that's something to kind of keep in mind when you go for your renewals, right?
Yes.
So as I scroll down here, when we talk about the attachments required, so what are the financial requirements that would need to go be attached to that? I know that when we look at that, what kind of backup do they need?
So for your financial requirements, you would need the last 30 days of, or the most current 30 days of pay stubs, or you can also use your current year W-2 or 1099, or your current year 1040 taxes that you filed as your to fulfill your financial obligation to the requirements of the pharmaceutical company. If something were to happen, say you were recently laid off or you were recently let go, you definitely want to reach out to your last employer and either use your layoff letter or a letter severing employment to submit as proof that you aren't currently employed.
Let's see. And then what's the Medicaid denial letter?
So a Medicaid denial letter is when you apply for your state Medicaid benefits and you're denied. Medicaid will send you a letter depending on how you applied for those benefits. It could be online, it could be to your email, or it could come to you in the mail. Not all manufacturers require the Medicaid denial letter. However, if it is a requirement, you definitely want to apply for your state Medicaid and you want to be able to receive that denial letter to have it with you. I would definitely suggest to apply for both the state Medicaid and the Medicaid, the prescription assistance program, because it may be approved without the Medicaid denial letter.
Okay.
So you hold up the possibility of getting your medication based on a letter that could take up to 30 days to receive.
I see. So you don't wait to have the letter in hand, but go through the process just in case you need it later.
Exactly.
Okay, that makes sense. So it says that the application can be faxed. Is that something that you yourself faxes, or should that come from the doctor's office or physician's office?
It should definitely come from your provider's office or the physician's office. It does need to be faxed. The application, the signed application, as well as the backup documentation should be faxed. And the provider does need to use the provider's company letterhead when sending off the application via fax.
Okay. And so then I see here the reapplication policy, as you had mentioned before, is that it's for you're eligible for a year, and then at the end of that time or right before then, you would submit your new financial information if you still needed to stay on the program. Is that correct?
You need to submit a new application along with your new financial information. Typically, you will receive a letter before your program end date to let you know this may be your last 30-day supply or 120-day supply, and it should give you a date more or less when you do need to reapply. And typically, most of the companies will also send you an application, and then all you would need to do is take that verify the information is correct if it comes pre-filled. If it doesn't, you definitely want to complete the application, give it to your provider, and have your provider sign it and submit it in a timely manner so that you don't have a lapse in coverage.
Okay, that makes sense. So then this says a refill form must be faxed to the program. What does that mean?
Well, good news is that with this company now, those are no longer, that is actually older information. Most of the pharmaceutical companies now are on what's called an auto ship, which means is that they're going to automatically ship a new 30-day or 120-day supply of your medication either to you or to your provider, and nothing needs to be done. Sanofi used to have it to where, yes, your provider did need to fax over a refill request, requesting a medication, but that is no longer valid. That no longer needs to happen. Also, specific medications such as Januvia, you can actually, or Jardiance, you can actually call in for yourself. When you receive your medication will have a number to the pharmacy as well as a prescription number. And a lot of the companies now are just like your local pharmacy. There's an automated system and you just type in the information or you speak the information that they're requesting, such as the prescription number, maybe your zip code, maybe the phone number that is listed on the application. And then that way, you yourself as the patient can refill your medication just like you would if going to your neighborhood pharmacy.
Great. So let's take a look at the form. So great thing is forms are available in both Spanish or in English, but let's pull that up so we can get a sense for what that might look like. And every form is going to be a little bit different. Each company is going to have their own form.
Every company will definitely have their own application.
Yeah. So it looks like they give a little overview as to who's eligible and if you're enrolled in Medicare Part D. Apparently, so for some of the folks that are in the donut hole with Medicare Part D, then some programs might be eligible to help you. And it gives you all the contact information, which is great. So as we look at the form, though, we're basically just looking at your name, social security, date of birth, and then they're starting to collect the household income information there. And you're going to have that attached to your form. So as you had said, your pay stubs or whatever you have that you're going to submit would then be attached to this form. It's not that, you just send that without that backup. And so when it asks about the insurance information, so if it is Medicare Part D, what do they need to do?
You still need to complete the application completely. So if you are uninsured, you would definitely check no. If you do have insurance, you check yes. Maybe it's a medication that isn't covered by your insurance plan. But if you have Medicare Part D, you do need to also check the yes, I have Medicare Part D. You need to complete all of the insurance information as well as send in a copy of the front and back of your Medicare, your Part D card. So whatever card you receive for your Medicare Part D, that is, they need a copy of the front and back, and you're definitely going to want to submit that because they are going to go ahead and verify the information. Once you complete that down there, if you look at the next page of the application, here we have, if you're just applying for patient assistance, that means you don't have any insurance at all, but maybe you need patient assistance along with the verification, the benefits verification. That means that company is going to go ahead, Sanofi is going to verify in regards to the insurance, if it's a covered medication or not, or maybe you just want the benefit verification only. Either way, you need to make sure you check one of those boxes. And then here we now are at the treatment and the prescribing information. This is going to be the part of the application that your provider is going to need to fill out completely and then sign and date.
Okay. And so I see that this kind of gives a list of all of the products that are available through the Sanofi Patient Connection. Do you need to fill out more than one application if you have more than one prescription from the same company?
So if you have more than one prescription from the same company, depending on the application, for example, the Sanofi application has space for 2 medications. If you have 3 medications, of course, you would need to fill out a secondary application to request that 3rd medication. And then everything can be sent together. You aren't going to need the duplicate proof of income because you're going to submit the 2 applications together. But on this particular form, you do have space for up to 2 medications.
Okay. And that may change based on which manufacturer you're using then. They may have more space or less space, right?
Some of them will have spaces with the actual different medications, and they'll have the medications listed, and then the provider will just need to check the boxes of the medications, and then of course put in the dosage as well as the directions. So based on each application is different, will definitely look different. You definitely want to read the application thoroughly and make sure that the person at the provider's office who is completing it, most oftentimes it's not the provider themselves completing it, but someone at the office completing it for them, and essentially the provider is signing it.
Right.
So you definitely make sure that you read through all of the information and make sure that whatever the pharmaceutical company is requesting on that first page is typically the information page. You definitely want to make sure that you have all of that when you submit the application.
Great. So how long does it take to find out if you've been approved?
Typically, it can take up to 7 to 10 business days before you receive a letter from the pharmaceutical company. And that's 7 to 10 business days. So typically maybe up to 2 weeks after you've submitted the application. Definitely keep a copy of the application that you submit for yourself so that you do have the contact information, because if you don't hear something back, you definitely want to reach out to the pharmaceutical company themselves, and speak to a customer service rep and ask in regards to the application. That's either if you receive an approval letter or a denial letter, or if they're missing information, the letter that says that you're missing something will definitely explain what it is you're missing, and it will give you a specific amount of time to turn in the information that you're missing. So you definitely want to be on the lookout for the mail.
So what if you're turned down? Is there any way to appeal?
So if you are turned down, they give you a reason why you have been turned down. And most oftentimes, clients are turned down because of lack of the missing income. So you definitely want to submit whatever income information that they are requiring with the application. If you're just missing it, just always pay attention and see what it is that they're requesting. They even give you a phone number that you can call, and you can reach out to a customer service rep for the company and ask, and make sure that you get it submitted within a timely manner. A lot of the companies will close out an application within 30 or right outside of a 30-day mark if you don't respond to the letter, and then you would definitely have to apply again.
Oh, that sounds like a pain. Nobody wants to do that.
Bye.
Any other tips that you want to share about navigating PEP programs?
Definitely go to the company's website. If you can look at the company's website, because it will give you program websites in the RX Assist itself. Pay attention to commercials, because a lot of times the commercials themselves will tell you this is where you can go if you are having trouble with paying for your medication. A Google search of either your medication or the actual manufacturer. And you definitely always want to put in prescription assistance program and look up the information. You'll be surprised about all of the valuable resources that that company may have. And sometimes they have resources outside of the medication that you thought you needed.
That's really good information. Well, it sounds like you've shared an awful lot of valuable information today, and I really hope this has been a benefit to everybody. But I really want to thank you for your time and your expertise and your willingness to share this with us today. Thank you so much, Sarah.
Thank you for having me.